Hey guys, my name's Chelsea, Doctor of Physical Therapy with Renew PT, and today we're going to talk about a simple way to activate your pelvic floor. So first I just want to review what your pelvic floor is. So your pelvic floor is this big group of muscles that sit at the base of your pelvis that are responsible basically for holding everything up. So this would be what they look like from the inside. You can see you've got your tailbone here in the back, and then all these muscles with openings for in the front. You've got your urethra, the vaginal opening in the female pelvis, and the anal opening. And then if you want to look from the underside, so this would be the front part. This is your pubic bone. And then these are your sit bones, just to kind of orient you here. So this would be looking from the underside. So you can see you've got kind of the anterior triangle, the forward, more forward part of your pelvic floor. So again, here's the front of your pelvis. So this anterior triangle here holds your vaginal opening and your urethral opening. There's muscles that anchor everything onto the pelvis, and then you've got muscles that run across to kind of separate the front part from the back part. So this would be your tailbone right here to keep you oriented. So here is kind of that posterior triangle here. So you've got the anus and then all the muscles that support you at the back. So why would you need to contract these muscles? So strengthening and contracting these muscles helps hold everything in, as far as stool and gas if you contract the back portion, and in the front portion helps you hold in urine. It also helps you support your organs. So your pelvic organs sit inside here, and that would be your bladder in the front, your uterus in the middle, and then your rectum in the back. So these pelvic floor muscles, along with some other ligaments, help hold those muscles up to keep them where they need to be. So when you strengthen your pelvic floor muscles, you are contracting them or tightening them. And so I'm going to show you an easy way to do that at home. And we will isolate both the front part here around the urethra and the vagina, and then also the back part around the anus. So this could be helpful for you if you are having issues with leakage. So whether you are leaking urine whenever you cough or sneeze or run or jump, or if you are leaking gas for the same reason whenever you cough, sneeze, run, and jump, or just randomly. Strengthening those pelvic floor muscles can help you control that. This may also be helpful for you if you have been diagnosed with pelvic organ prolapse. So we talked about those organs in your pelvis, so the bladder, the uterus, and the rectum. Sometimes they can start to slip down if they're losing support from the ligaments that hold them up and if your muscles are weakened. So strengthening your pelvic floor can help support those organs and lift them back up to where they need to be. So what you'll need to get started is a therapy ball. If you don't have a ball, you can certainly sit on a chair or a stool, something maybe that doesn't have a back to it. Or if it does have a back to it, just make sure that you are scooting up to the edge of your chair or your stool. That will just help you get your pelvis into the right position to be able to contract these muscles. So I'm going to turn to the side, just so you can see what I'm doing. So I'm just sitting on my ball with normal posture. And the first thing you want to do, we're going to think about contracting the front part of the pelvic floor. So when you do that, all you'll do is tip your hips forward. So you will arch your back and pretend like your pelvis is coming forward. The top hip bone should be pointing directly forward. When you do this, you will feel more pressure around your pelvic bones or your pubic bones. So in this position, you can take a deep breath in and then blow out. And as you blow out, focus on contracting the front part of your pelvic floor. So if you remember, the front part of that pelvic floor is where your urethra and your vagina are. So you're wanting to tighten and lift that area. So that would be good if you're having issues with incontinence of urine, if you're having leakage whenever you cough and sneeze, if you are urinating whenever you cough and sneeze, or just having issues with that. So next we're going to isolate the back part, or that back posterior triangle where your anus is. So in order to do that, all you'll do is tip the hips under to where you are kind of bringing the hip bones back. So these top hip bones should be pointing back, your tailbone should be tucking under. And in this position, you can really feel the pressure around the anal area, and you will just squeeze in like you're trying to stop the passage of gas. So if you want to do those two together, you'll tip forward, feel the pressure in the front and squeeze, and then tip backward, feel the pressure in the back and squeeze. And again, you don't have to have a ball necessarily. It does make it easier in order to kind of rotate that pelvis back and forth, but you can certainly do it without a ball as well. So again, forward tilt, anterior tilt to get the front part of the pelvic floor, posterior tilt, tipping the hips backward to get the back part of the pelvic floor. This can be an easy way to isolate the two different groups if you feel like you're having a hard time doing the exercise correctly, whether you're laying on your back or on your side. So I hope you found this helpful in order to easily contract that pelvic floor. Again, just remember there are two portions. So you've got that front area, which can really be isolated if you're having issues with urinary incontinence, and then the back triangle area that can be useful to isolate if you're having issues with leaking stool or gas. Thanks for watching.